Hi everyone. So today we are continuing with the Ocular Formulations and OcusertsSession session 2. So last class we have discussed the type of ocular formulations as erodible as well as non-erodible, and we discussed the various non-erodible ocuserts and contact lenses. So today we are discussing on the erodible inserts. The erodible inserts are of two types. The one is of LACRISERT, another one is of soluble ocular drug insert, that is SODI. So let us discuss what is LACRISERT. LACRISERT is a prescription lubricant that is inserted into the eye to provide up to 24 hours relief from moderate to severe dry eye symptoms. Actually, this LACRISERT is again the trade name for the ocular insert developed by the Bausch and Lomb for treatment of the dry eye syndrome. The key features of this LACRISERT includes once a day administration for many of the people, but still there is some exemptions. Then continuous lubrication throughout the day. There is also certain exemptions. It is preservative free and proven to reduce the dryness, burning, tear, grittiness, itching, light sensitivity and blurred vision. So let us see how the LACRISERT functions.
Once daily prescription LACRISERT is a small, translucent, preservative-free ophthalmic insert containing hydroxypropyl cellulose. LACRISERT is a slow-release artificial tear that lubricates and protects the eye. An insert is placed in the eye once a day and can provide relief from moderate to severe dry eye. LACRISERT is easy to use and with practice can be placed in less than a minute. Begin by washing your hands thoroughly. Place the blister unit on a flat surface with the label side up. Then, carefully peel back the white label. Without touching the grooved tip, briefly rinse the flexible applicator under hot water. Gently shake off the excess water. The remaining moisture will help LACRISERT adhere easily to the applicator. To pick up LACRISERT, lightly press the grooved tip of the applicator to the insert. Looking slightly upward in a mirror, use your thumb and index finger to softly pull down and away on the lower lid from the outer corner of the eye. This will create a pocket between the white part of the eyeball and the eyelid. Guide the applicator to carefully place LACRISERT in your eye. Avoid touching the colored part of the eye. Brush the insert lightly against your inner eyelid. It should easily drop off, settling deep in the pocket. Using LACRISERT as instructed should reduce any foreign body sensation or risk of movement to a different part of the eye. After a few tries, you should find a method of placement that works best for you. The insert itself cannot be seen because it is in the pocket of your eyelid. Within minutes, LACRISERT softens as it begins to dissolve, providing the lubrication and protection your dry eyes need. Using one LACRISERT every day can provide all-day relief from your dry eye symptoms. However, some patients may need 2 inserts a day to achieve the best results. Individual results may vary. LACRISERT will fully dissolve in your eye, but if you need to remove it, the process is simple. With clean hands and using a mirror, locate the LACRISERT insert in the pocket of your lower eyelid. With your eye closed, use your fingers to push it upward. Carefully remove LACRISERT with a clean tissue once it slips over the lower eyelid. LACRISERT is an insert placed in your eye to treat moderate to severe dry eyes. It also can be used to treat the following eye conditions: exposure keratitis, decreased corneal sensitivity, and recurrent corneal erosions.
That's it. So, I hope you understood how the LACRISERT functions. So, they are purely an erodible type of inserts to treat the dry eye syndromes. How does it work? So, this LACRISERT softens as it dissolves slowly over a course of 1 day to stabilize and thicken the tear of the eye. So this allows the natural tears to be better maintained throughout the day as your tear film thickens. It can protect the surface of your eye longer and you should begin to feel the relief from your dry eye symptoms. And it's purely act as a substitute for our tears. So those who have the lower tear secretion, those who have the patients with the poor tear film formation, they may feel the symptoms of dry eye. So in order to overcome this dry eye symptoms, just by inserting one LACRISERT per day will help to reduce the discomfort of the dry eye symptoms. The main contraindication is it's only contraindicated for the patients who are hypersensitive to hydroxypropyl cellulose because the LACRISERTs are fully made of hydroxypropyl cellulose. The next one is soluble ocular drug insert. Again, the SODI is also a soluble copolymer of acrylamide, vinyl pyrrolidine and ethyl acrylate. So they also form a sterile thin film over the surface of the cornea. They are of oval in shape, weighing around 15 mg. So this can be inserted into the conjunctival sac and within 10 to 15 seconds it becomes soft. Once it becomes soft, it changes its shape towards the shape that is similar to the eyeball, and in next 15 to 15 minutes the film forms a polymeric coat and it slowly dissolves within the eye after a particular period of time, and at this stage it slowly releases the drug from its polymeric coat. So this is how the SODI works. So it's again made up of certain polymers which is having the drug inside it. After inserting the insert SODI into the conjunctival sac, it takes up the tears. Within 10 to 15 seconds it's becomes softer. After it becomes soft, it spread over the corneal film and it slowly releases the drug for a period of 1 hour or more than that. So the main advantage it offers is it reduces the role of clinicians, because for inserting and if it requires any sort of removal also, we can insert and we can remove without the support of any of the doctors or nurses. And there is no surgical insertion is also required for this type of SODI. And the main drawback also, they may affect the vision in the sense, as we discussed, initially it becomes soft and forms a polymeric coat over the surface of the cornea. So this polymeric coat formation, initially it may produce certain blurred vision. So this is not permanent for a longer time, just for a shorter period of time it may produce a blurred vision. Now the release of the drug from SODI occurs in two different stages. First stage is hydration of the matrix by penetration of the dissolution medium and diffusion of the medium deep into the matrix and back diffusion of the dissolved active drug molecules. Now what is the dissolution medium here? The dissolution medium is the tears. So the SODI what you are inserting is purely dry enough. Once after the SODI gets administered, considering based upon the principle of wettability, it takes up the tear film from the conjunctival sac. So it absorbs the tear films. So the tear film may penetrate into the matrix of the polymer system or the delivery system. It solubilizes or it softens, and again it penetrates in deep into the matrix of the ocular insert. So once this tear film reached inside the ocular insert, it solubilizes the drug within the ocular system, within the delivery system, and next is the movement of drug molecules from the delivery system into the ocular cavity. So this way, in these steps, the SODI releases the drug molecules. A single SODI application can replace 4 to 12 drug installations or 3 to 6 applications of ointment and constitute the valid once-a-day therapy for treatment of glaucoma as well as the trachoma. So if the drug is administering as eye drops, as we know, the frequent administration is required. That is one of the main drawback of ophthalmic delivery systems. By application of such type of SODI, it gives a slow release, a controlled release, and a consistent drug therapy in the eye. So this is one of the main advantage of SODI. Okay, so these are the two types of erodible ocular inserts. Okay, I hope it is clear. So with this, the session is completed. The ocular drug delivery system is completed. So those who are not clear about the anatomy of the eye, then the various barriers of the eye, the methods to overcome the barriers, then ocular formulations and OcusertsSession. These are the main 5 sessions we carried out in this chapter. Okay, so those who are not clear, kindly go through the previous videos. Okay, thank you.